Medications that decrease the blood pressure. The cardiac output, peripheral resistance, and blood volume interact to create blood pressure. Cardiac output is the product of the heart rate and the stroke volume, the amount of blood that is pumped with each heartbeat. Peripheral resistance is determined by the size and flexibility of the arteries. Therefore, the force of the heart's contraction, the amount of blood that is pumped, and the resistance or give of the blood vessels all influence blood pressure. The kidneys also play a key role by regulating circulating fluid volume. Blood pressure is the pressure of circulating blood on the walls of arteries and veins, and the blood moves through the body with each contraction and relaxation of the heart. A healthy blood pressure maintains circulation to major organs in all parts of the body during rest and during activity. Blood pressure that is too high or too low can cause critical problems that affect blood vessels, organs, and tissues. Many things can affect the blood pressure, including heart rate, how well the heart contracts, certain hormones, blood volume, physical activity, and stress. Hypertension, high blood pressure, is a disorder in which the patient's blood pressure is constantly elevated above normal values. If left untreated, hypertension damages major organs, including the heart, brain, and kidneys. Managing hypertension dramatically reduces the odds of heart attack, stroke, and kidney failure. There are two kinds of hypertension. In primary hypertension, the specific cause is unknown. In secondary hypertension, the blood pressure changes results from a specific cause. If the cause is treated or managed, the blood pressure naturally returns to normal. About 90% of cases are primary hypertension, which cannot be cured, but can be well managed with good drug therapy. This section focuses on managing the primary hypertension. Although hypertension is the technical term, we use the phrase high blood pressure to discuss drugs and nursing management. In the past, use of the term hypertension created the impression that a person would be feeling hyper if his or her blood pressure was too high, even though hypertension or high blood pressure is often without symptoms. When patients felt calm, they believed their blood pressure was normal and did not think they needed drugs. This led to too much confusion between patients and their healthcare providers. High blood pressure is a simpler term, and patients understand it better than hypertension. According to the American Heart Association, high blood pressure affects as many as 1 in 3 adults, 20 years of age or older. Although the exact cause of hypertension is unknown, risk factors include a family history of high blood pressure, African American race, overweight or obesity, physical inactivity, current cigarette smoking or exposure to secondhand smoke, and too much alcohol consumption. People with diabetes, elevated blood lipid levels, or kidney disease also are at higher risk for high blood pressure. Risk increases with age, and it is not surprising that as the population ages, there will be a need for a good understanding of high blood pressure management. Whatever the cause, when high blood pressure is untreated or poorly treated, serious health problems and even death can develop. High blood pressure can be caused by poor heart action, arteriosclerosis, kidney failure, narrowed blood vessels, chronic stress, poor coping mechanisms in dealing with stress. The severity of high blood pressure is classified according to the stages that are listed on a table inside of Chapter 9 on page 146. The term prehypertension has been eliminated in favor of the more accurate term elevated blood pressure. The accurate diagnosis is essential to determine the best treatment for patients. LPNs have an important role in using the proper technique for blood pressure screening, and you will work with the healthcare team to reinforce recommended lifestyle changes. You can visit the website www.cdc.gov/blood pressure/facts.htm. You can also visit www.heart.org/en/topics/high-blood-pressure for accurate and evidence-based information regarding the statistics and the current practice for the parameters of blood pressure recommendations. If lifestyle changes alone are not effective in reducing the patient's blood pressure, healthcare providers will begin drug therapy. Choices of prescribed drugs may depend on the patient's age and race, and whether the patient has diabetes or chronic kidney disease, which can complicate treatment. Do not hesitate to communicate with the healthcare provider if you are not clear about your patient's blood pressure goals. The recommended lifestyle changes for patients that have high blood pressure is to stop smoking, to eat a well-balanced diet, decrease sodium, salt intake. It doesn't mean to eliminate. Explore ways to reduce the stressors or the stress in life, the healthy ways to be able to deal or cope with stress. Some patients don't have coping mechanisms. Maintain a healthy weight. Try to get 40 minutes of moderate or intense exercise 3 to 4 times a week. Limit the alcohol to no more than 2 drinks per day for men and 1 drink per day for women. And avoid all over-the-counter drugs that can rise blood pressure. An antihypertensive is a drug that has the main purpose of lowering blood pressure. A variety of drugs can lower blood pressure by different mechanisms. Not all patients respond to any one class of blood pressure. Lowering drugs in the same way. Drug therapy for high blood pressure often requires trial periods to establish the right drug or drug combinations to help a patient achieve his or her blood pressure goal. For the general population, non-African American patients typically begin with thiazide diuretics. These drugs may be prescribed alone or in combination with angiotensin-converting enzyme inhibitors, also known as ACE, or angiotensin II receptor blockers, also known as ARBs. For African American patients, thiazide diuretics and calcium channel blockers are used alone or in combination for best management. For patients with diabetes and or chronic kidney disease, ACEs and ARBs are used. Additional classes of drugs commonly used in the management of high blood pressure include beta blockers, alpha blockers, alpha 2 agonists, combined alpha and beta blockers, and vasodilators. Although the antihypertensive drugs have different actions, some nursing implications are the same for all of them. There is a box that describes the common nursing considerations for giving antihypertensive drugs, and the nursing considerations and the patient teaching issues specific to any single antihypertensive drug that are listed within the individual drug categories. The general nursing implications for antihypertensive drug therapy. The assessment is to gather baseline vital signs before giving any drug for high blood pressure. Get a complete list of all the drugs that the patient is currently taking, including anything that is prescription as well as over-the-counter and herbal. Assess the patient's use of alcohol and or illegal drugs that may potentially interfere with the drug therapy or increase the risk of adverse effects. Review the patient's laboratory work, particularly that is related to the kidney function tests, which would be the BUN and the creatinine, and any of the electrolytes, which would be the sodium, potassium. Assess for the patient's fluid balance, including the presence of any edema or any symptoms of existing dehydration. Planning and implementation. Teach the patient to report all over-the-counter drugs and check with a healthcare provider to avoid dangerous drug interactions. There are over-the-counter cold medications that patients should not be consuming while they are taking antihypertensive drugs. Remind the patient to avoid sudden changes in position because most antihypertensive drugs can cause orthostatic hypotension, and this is how patients end up falling and fracturing their hips or obtaining subdural hematomas. Withhold the blood pressure drug if the patient has a blood pressure measurement that is lower than, the book says 90/60. I'm telling you to cross that out. It should say 100/60. Millimeters of pressure, Hg, and notify the healthcare provider. So if your blood pressure of your patient is less than 100/60, and if your pulse of your patient is less than 60, you should further assess for dehydration, and you should also withhold any of your antihypertensive drugs because there is no more room for this blood pressure to fall. So administering that antihypertensive drug is really contraindicated right now. Monitor the blood pressure every 4 to 8 hours and as needed at the beginning of therapy in case the patient has a significant drop in blood pressure. Monitor potassium levels to assess whether they are within the normal range. Report abnormal levels to the healthcare provider. Teach the patient to avoid alcohol because it can cause hypotension in patients who are taking blood pressure drugs. Give the patient the drug at the same time every day. It is important to avoid missing doses because missed doses can cause rebound hypertension or high blood pressure. Teach the patient to keep taking the drugs as prescribed because they do not cure high blood pressure. Initiate the fall risk precautions for older adult patients who are taking high blood pressure drugs. In the evaluation, monitor the patient's blood pressure on a regular basis to determine how well the patient is responding to the drug. Report any side effects or adverse effects to the healthcare provider and track the patient's response to the drugs to determine whether they are effective. Continue to reinforce the healthy lifestyle changes as well. In the meantime, as you are continuing to administer this drug to the patient, you never want the patient to fall into the parameter of having hypotension. We want them to fall into the parameter of a therapeutic dose and a therapeutic blood pressure parameter. So making sure that we understand where the doctor wants this patient's blood pressure to be in the outcome is an important goal. And then to make sure the patient also understands that too. That way, when the patient loses weight or the patient needs an adjustment in his medication, we all can keep an eye on that and make sure that happens. Many types of drugs are available to treat high blood pressure. The drug selected for use depends on the severity of the disease. The drugs act at many sites in the body and in several different ways. Patients may need several types of drugs to achieve the best management of their blood pressure. Antihypertensive drugs are grouped in 5 main categories. Diuretics indirectly reduce blood pressure by producing sodium and water loss, thereby reducing fluid volume. Renin-angiotensin aldosterone system, known as RAS, RAAS drugs, which work by decreasing vasoconstriction and decreasing fluid volume to decrease blood pressure, include these drugs. Angiotensin converting enzyme inhibitors, known as ACE, angiotensin II receptor blockers, known as ARBs, calcium channel blockers decrease blood pressure by relaxing vascular smooth muscle in the coronary and systematic arteries, leading to decreased peripheral resistance. Adrenergic agents used for the treatment of high blood pressure affect epinephrine and norepinephrine, which are neurotransmitters in the nervous system. Depending on the receptor, these drugs can decrease vasoconstriction and decrease contractility of the heart, thereby decreasing blood pressure. Adrenergic agents include beta blockers, non-selective, selective, alpha-1 antagonists, alpha-2 agonists, and combined alpha and beta antagonists. Vasodilators directly affect the arterial and or venous system to decrease peripheral resistance. Renin-angiotensin aldosterone system drugs. Renin-angiotensin aldosterone system, also known as RAS drugs, including ACE inhibitors and ARBs, interfere with the actions of angiotensin II and aldosterone to decrease blood pressure by decreasing vasoconstriction and fluid volume. When a person's blood pressure drops, cells in the kidney release a hormone called renin into the blood. Renin helps produce angiotensin I. Angiotensin I is converted to angiotensin II by an enzyme called the angiotensin converting enzyme ACE. angiotensin II is a hormone that causes vasoconstriction and stimulates the adrenal cortex to increase aldosterone secretion. Aldosterone then can increase water and sodium reabsorption. This works very well in helping to raise the blood pressure back to normal. A good grasp of this process is helpful in understanding how ACE inhibitors and ARBs act to reduce high blood pressure. Uses of antihypertensive drugs. Antihypertensives and diuretics are used alone or in combination to decrease elevated blood pressure to a desired level according to accepted guidelines. By maintaining normal blood pressure, these drugs help prevent complications of acute and chronic high blood pressure. As you work with patients, you may see that several trials of different prescriptions are often needed before the right combination of drugs is achieved for the best control. Careful monitoring is essential. Angiotensin-converting enzyme known as ACE inhibitors is a classification. It's a type of RAS drug that reduces high blood pressure by stopping the conversion of angiotensin I to angiotensin II, the hormone that causes the vasoconstriction and increased aldosterone. The examples of this drug are captopril, known as Capitan, enalapril, known as Vasotec, fosonapril, known as Monopril, and lisinopril, known as Provenal. Notice that all of these drugs have a very common ending known as pril. So this is one way to be able to identify these ACE inhibitors, is that they all have a common ending in pril. The nursing implication for ACE inhibitors is to avoid sudden changes in position because most antihypertensive drugs cause orthostatic hypotension. Teach patients that these drugs can have a first dose effect, which increases the risk of falls and dizziness. This first dose effect means that initially starting this drug, there is a higher risk of hypotension that can occur with the patient. So this patient is definitely more likely to experience that orthostatic hypotension when they first get out of bed. Remind patients to keep taking the drug exactly as it's prescribed, because this drug does not cure high blood pressure. ACE inhibitors and ARBs can cause hyperkalemia, high potassium levels. Remind patients to avoid high potassium foods. Monitor patients' blood pressure levels regularly to determine how well they are responding to the drug. Some patients may experience a dry cough while taking ACE inhibitors. If so, report this to the healthcare provider, who may switch the patient to an ARB because they do not cause cough. If the patient experiences swelling in the eyes, the mouth, the face, or tongue, contact the healthcare provider immediately, because this could be a sign of angioedema, which is a potentially life-threatening condition. The drugs can cause severe birth defects. This is not a drug to take if you're suspecting to become pregnant or if you are pregnant. Teach the patients to take these drugs and to avoid alcohol, because drugs and alcohol, or this drug particularly, and alcohol together can potentiate significant hypotension. Remind the patient to avoid over-the-counter drugs until checking with a healthcare provider to avoid dangerous drug-to-drug interactions. Angiotensin angiotensin receptor blocker, known as an ARB. Blocks the action of angiotensin II, preventing constriction of blood vessels. This is commonly used when ACE inhibitors are not tolerated. The examples are irbesartan, known as Avapro, losartan, known as Cozar, valsartan, known as Diovan. Notice that all of these drugs have a common ending of sartan. So you should be able to associate that your ARBs end in sartan. An angiotensin II receptor blocker, known as an ARB, is a type of ROS drug that blocks the vasoconstrictor and aldosterone-secreting effects of angiotensin II. It lowers blood pressure by selectively blocking and binding of angiotensin II at receptor sites found in many of the tissues. Both ACE inhibitors and ARBs decrease vasoconstriction and decrease the release of aldosterone, decreasing fluid and lowering blood pressure. Calcium channel blocker is another classification. These dilate arteries to decrease peripheral vascular resistance. They reduce the workload of the heart, therefore decreasing the blood pressure. The examples are amlodipine, known as Norvasc, diltiazem, known as Cardizem, and nefenpetamine, known as Procardia XL, also known as Adalat, and verapamil hydrochloride, known as Calan. Calcium ions are very important in the contraction of the heart and vascular smooth muscle. Calcium flows into muscle cells through tiny channels in their membranes and works as a switch which allows the muscle fibers to slide past each other and shorten to contract at the end of each contraction. Calcium flows out of the channels, which allows the muscles to relax and lengthen again. Calcium channel blockers are a class of antihypertensive drugs that allow blood pressure by reducing the effect of calcium in the heart muscle and in the smooth muscles of the arteries. They work in two main ways. Calcium channel blockers help slow the flow of calcium ions across the cell membranes, reducing the amount of calcium available for arterial smooth muscle, contraction, and producing relaxation of coronary and systemic arteries. With relaxation of the smooth muscle, blood flow improves and blood pressure decreases. The oxygen can then get into the heart muscle, where it is needed. Some calcium channel blockers slow the flow of electricity through the cardiac conduction system, slowing the heart rate, and can be used to treat abnormal heart rhythms. You may see them used in patients with high blood pressure, patients with angina, and patients with abnormal heart rhythms, also known as dysrhythmias. Fluid retention is a common side effect of calcium channel blockers, and these drugs should be avoided in patients with heart failure. The nursing implications for calcium channel blockers: avoid sudden changes in position because most antihypertensive drugs cause orthostatic hypotension. Remind patients to keep taking the drugs as prescribed because they do not cure high blood pressure. Monitor patients' blood pressure levels regularly to determine how well they are responding to the drug therapy. Patients should avoid alcohol because it can cause hypotension in patients taking these drugs. Remind patients to avoid all over-the-counter drugs until checking with a healthcare provider to avoid dangerous drug-to-drug interactions. Notify the provider if the patient experiences swelling in the legs because this drug can cause fluid retention caused by the calcium channel blocker. Calcium channel blockers are avoided in patients that have heart failure because of the potential for fluid retention. Teach patients to avoid grapefruit and grapefruit juice while taking calcium channel blockers, as it may increase the risk for toxicity. Be alert for signs and symptoms of Stevens-Johnson syndrome, arrhythmia, multiform, a life-threatening skin condition that can be an adverse effect of calcium channel blockers. The condition is associated with skin lesions, fever, and aching joints. Report heart rates slower than 60 beats per minute and blood pressure levels lower than 100/60 to the healthcare provider before giving the drug to avoid significant hypotension. If you are caring for a patient who is receiving an IV calcium channel blocker, check with the RN or the healthcare provider regarding the need for a bed with a cardiac monitor. Calcium ions are very important in the contraction of the heart and vascular smooth muscle. Calcium flows into muscle cells through tiny channels in their membranes and work as a switch that allows muscle fibers to slide past each other and shorten to contract. At the end of each contraction, calcium flows out of the channels, which allows the muscles to relax and lengthen again. Calcium channel blockers are a class of antihypertensive drugs that lower blood pressure by reducing the effect of calcium in the heart muscle and in the smooth muscles of arteries. They work in two main ways. Calcium channel blockers help slow the flow of calcium ions across cell membranes, reducing the amount of calcium available for arterial smooth muscle contraction and producing relaxation of coronary and systemic arteries. With relaxation of the smooth muscle, blood flow improves and blood pressure decreases. The oxygen can then get into the muscle of the heart where it is needed. Some calcium channel blockers slow the flow of electricity through the cardiac conduction system, slowing the heart rate, and can be used to treat abnormal heart rhythms. You may see them used in patients with high blood pressure, patients with angina, and patients with abnormal heart rhythms, also known as dysrhythmia. Another classification is a beta-adrenergic blocker. It acts on the autonomic nervous system. It blocks the stimulation of a beta-1, which is the myocardial. It relaxes the fight or flight response. Some examples of this drug is atenolol, known as tenormin, metoprolol, known as toprolol, nadolol, known as Corgard. Notice that all of these drugs have a common ending of OLOL. So, kind of a slang term to think about is better block them, OLOL. This is kind of what you can think about when you think of a beta blocker. You have one heart. This is a beta 1. So this acts actually on the beta 1 cells that are inside of the heart. There are two main types of beta receptors. Beta 1 receptors located primarily in the heart and beta 2 receptors located primarily in the lungs. An easy way to remember which type of receptor is affected by the drug is this: beta 1, 1 heart; beta 2, 2 lungs. Stimulation of beta 1 receptors leads to increased heart rate and increased contractility of the heart. This is very helpful when you are healthy and need to fight or flight mechanism to work for you. In patients with high blood pressure, however, the response can be harmful and drugs are used to block the response. A beta blocker is an antagonist drug that blocks the activity of beta adrenergic receptors. These drugs are classified in two groups: non-selective and selective beta antagonists. The non-selective agents block both beta 1 and beta 2 sites. That is, they affect both beta 1 heart receptors and beta 2 lung receptors. Blocking beta 1 receptors decreases heart contractility and heart rate, which can decrease blood pressure. On the other hand, blocking beta 2 adrenergic receptors causes bronchoconstriction, which can be a problem, especially in patients that have asthma. For that reason, the newer selective beta 1 blockers are better for patients with high blood pressure or other heart problems. They do not have an effect on the lungs at normal doses. The nursing implications for beta adrenergic blockers: withhold the drug if the heart rate is slower than 60 beats per minute, or if the systolic blood pressure is less than 100 millimeters of pressure systolically, and if the diastolic is less than 60 millimeters of pressure. Teach the patient that common side effects include decreased sexual ability, dizziness, drowsiness, and difficulty sleeping or weakness. Some patients may experience cold hands or feet. Tell patients to report symptoms of depression to their healthcare provider. Teach diabetic patients that beta blockers can mask signs of hypoglycemia, except for sweating, and remind them to check their blood sugar levels regularly to treat low or hypoglycemia. To avoid rebound high blood pressure, do not stop beta blockers suddenly. Another classification is vasodilators. The action of this drug is that it decreases the pressure of the heart as it exerts, decreasing the oxygen demand. An example of this drug is hydralazine, also known as apresilene. Vasodilators are a class of drugs that dilate, widen, or relax blood vessels in several ways. Some dilate arteries and veins by preventing contraction of smooth muscle cells. Others cause vasodilation by affecting the CNS. Some drugs work primarily on the arterial system, some more on the venous system, and some work on both arteries and veins. Dilation of the blood vessels decreases blood pressure, improves blood flow to the major organs, and decreases the workload of the heart. Monitor blood pressure carefully at the beginning of therapy in case the patient has a significant drop in blood pressure. Teach the patients to weigh themselves every day and to report swelling in the hands, feet to their healthcare provider. Remind patients to take the drug at the same time every day. It is important to avoid missing doses because missed doses can cause rebound high blood pressure. Teach the patients to change positions slowly to avoid that orthostatic hypotension. Nursing assessment, planning, and implementation. In assessing your patient with high blood pressure, remember to consider all modifiable and non-modifiable risk factors. For example, knowing that African Americans have a higher risk factor of high blood pressure than whites will remind you to carefully screen for high blood pressure, as African Americans may require drug therapy at a younger age than whites. Assessing patients for smoking, levels of physical activity, and high sodium, high fat diets is also important. Lifestyle changes are critical whenever the patient is taking drugs for high blood pressure or less or has elevated blood pressure. For all patients with high blood pressure, it is critical to gather a thorough drug history. Certain prescriptions, over-the-counter drugs, herbal preparations, and even illegal drugs can cause high blood pressure. Common prescription drugs such as glucocorticoid steroids, oral contraceptives, non-steroidal anti-inflammatory drugs called NSAIDs, and over-the-counter drugs for cough and cold symptoms may cause the patient to have elevated blood pressure. Patients who use illegal drugs such as cocaine, anabolic steroids, and amphetamines often are diagnosed with high blood pressure when they are seen by healthcare providers for any reason. This can occur even in teenagers and young adults. As an LPN/VN, you may have the most contact of any healthcare professional with patients in your care setting. And building a trusting relationship can help you screen for these and other risk factors for high blood pressure. Before giving any drug that affects blood pressure, baseline blood pressure and heart rate checks are essential. Knowing the patient's blood pressure and heart rate before you give a drug helps you to evaluate the patient's response to the drug. Drugs such as beta blockers affect the blood pressure and the heart rate. If the heart rate is lower than 60 beats per minute, withhold the drug and contact the healthcare provider. For several categories of drugs, you need to monitor the electrolyte levels. An example is the potassium level. If you are giving an ACE inhibitor and the potassium level is greater than 5.0 milliequivalents per liter, withhold the drug and contact the healthcare provider, because an ACE inhibitor can cause hyperkalemia. If you are giving a diuretic such as furosemide, you should watch for hypokalemia, potassium levels lower than normal. The planning and implementation of high blood pressure has no cure, but it can be well managed. It is important to involve your patient in planning care as much as possible, so that he or she will be better understanding why taking a prescribed antihypertensive drug is important. For best results, patients need both drug therapy and lifestyle changes. High blood pressure usually does not have symptoms, and patients may not feel sick. It is important for you to reinforce with the patient why treating high blood pressure is important for maintaining good health, even if no symptoms are present. Some expected side effects of antihypertensive drugs. All blood pressure drugs can cause hypotension, which is blood pressure that is too low to maintain adequate circulation. Most can cause orthostatic hypotension, which is dizziness that occurs when changing positions. Symptoms associated with blood pressure that is too low include dizziness, weakness, and confusion, particularly in older adults. These symptoms can lead to an increased risk of falling. As you study each class of drugs, remember that you need to be able to recognize the difference between expected side effects and adverse reactions. When the blood pressure drops below 100/60 millimeters of pressure, or the patient is experiencing severe side effects, you should notify the healthcare provider to determine whether an alternative drug would work with fewer side effects. The adverse reactions of antihypertensive drugs. Each class and each drug has many potential serious adverse reactions. The specific adverse effects are discussed. Fluid retention is a common side effect of calcium channel blockers, and these should be avoided in patients that have heart failure. In the older adult, particularly are at risk for dizziness when taking antihypertensive drugs. The orthostatic hypotension they experience places them at risk for falling when they rapidly change positions, such as getting up quickly from a chair or from a bed. Teach patients who are taking antihypertensive drugs to stand up slowly and to avoid dizziness. Hopefully this will help to prevent falls. Frequently, a patient with high blood pressure has to take many different drugs because he or she has other medical problems. All antihypertensive drugs can have drug interactions. Check each drug the patient is taking. Interactive effects that lower the blood pressure too much or make the blood pressure go even higher can occur. Consult a drug reference book or a pharmacist for more information about interactions between the patient's prescribed antihypertensive drug and any other drug he or she is taking. The patient and family teaching. Tell the patient and the family the following. Take this drug exactly as it is ordered. If a dose is missed, it should be taken as soon as it is remembered. If the next scheduled dose is close, skip the missed dose and return to the regular dosing schedule. Teach proper techniques for home monitoring of blood pressure and heart rate. If the blood pressure is lower than 100/60 millimeters of pressure, or the heart rate is less than 60 beats per minute, contact the healthcare provider. Keep a daily record of your blood pressure to bring to your appointment. This helps the healthcare provider make sure you are taking the most effective drug. Remember to get up slowly from a lying or sitting position to avoid dizziness from getting up too fast. Notify your healthcare provider of any new or uncomfortable symptoms that may develop. These symptoms may indicate an adverse effect or may be relieved by simply changing to a new drug. Avoid alcoholic beverages while taking drugs for high blood pressure, and keep with you a list of the drugs that you take so that all healthcare providers will be aware of the doses and types of drugs that you are taking. The evaluation or desired outcome for any antihypertensive drugs is all blood pressure drugs can cause hypotension, which is blood pressure that is too low to maintain an adequate circulation. Most can cause orthostatic hypotension, which is dizziness that does occur when changing positions. Symptoms associated with blood pressure that is too low include dizziness, weakness, and confusion, particularly in the older adults. These symptoms can lead to an increased risk of falling. As you study each class of drugs, remember that you need to be able to recognize the difference between expected side effects and adverse reactions. When the blood pressure drops below 100/60 millimeters of pressure, or the patient is experiencing severe side effects, you should notify the healthcare provider to determine whether an alternative drug would work with fewer side effects.